Today on Chet Talks, we are joined by one of digital health's most widely respected health movers and shakers, Lee Shapiro. Lee, who graduated from both one of the country's top accounting, University of Illinois at Urbana-Champaign, and law programs, University of Chicago, has been a leader in healthcare for the past 20 years. Lee's a longtime partner at the venture capital firm 7 Wire Ventures, where he invests in digital health companies. In addition, from 2000 to 2012, Lee was the president of Allscripts, one of the largest electronic health records companies. And since 2013, Lee has served as the chief financial officer of Livongo Health, which is transforming care for individuals with diabetes. In July of 2019, Livongo became one of the first publicly traded digital health companies, and its stock price has more than tripled since then. 2 weeks ago, Livongo announced its plan to merge with Teladoc to create one of the largest digital health companies in the world. Today, we're delighted and excited to welcome the very busy Lee Shapiro to Chet Talks. Lee, welcome.
Thanks so much for having me, Ray. Glad to be here.
Before we discuss the merger and investing, let's talk about Livongo. What is Livongo?
Livongo is a consumer-centered virtual care company. We allow individuals to be empowered to manage their own health, and we allow them to live better and healthier lives. We do that by providing smart connected devices that are sharing information with your permission to the cloud, and by using that information and data science through our AI engine, we are allowing individuals to receive ongoing guidance at the time that they're thinking about their health to make appropriate changes that allow them to stay healthy. The key with Livongo is that we fit into individuals' life flow. You think about workflow, but for all of us, it's our life flow, and do it in a way that allows them to take advantage of new technologies that we use in so many other aspects of our lives, but now we can use it to transform the delivery of care.
When you started Livongo in 2013, success was very far from certain. What was your biggest challenge then, and how did you overcome it?
Well, Glenn Tolman, the founder of Livongo, and I, through 7 Wire Ventures, invested in a wonderful technology, a smart connected glucometer in 2013. And we used that as the core of building a services business, a technology-enabled services business that became Livongo. But whenever you introduce new models of delivery, there's some resistance. And one of the things that we realized, especially with Glenn's experience with his son Sam, who has type 1 diabetes, he saw that the model that existed to provide care to individuals with diabetes wasn't very consumer friendly. Case in point, if you are an individual with diabetes, you might receive a certain allotment of test strips for a given period of time, a month or 3 months. But when you run out of those strips, you have to come out of pocket to buy more strips. And in fact, many people will ration strips in order to save them. They might delay testing at the end of a period, waiting for new strips to be searched and are sent to them, as opposed to kind of searching in their couches for strips. And we thought, you know what, this is a crazy model. We want people to test. We want the data to allow them to stay healthier. And so our business model was provide strips at no cost. Our service is sponsored by health plans and self-insured employers, but the strips to the consumer and Lancets and the smart connected glucometer, they're all free. And so you can imagine that companies that sell test strips didn't like that model. And they did everything they could to try and kill us in those early days. But what we saw was that by delivering better information and helping consumers to change their behavior, we were delivering great outcomes. We were improving blood sugar levels. We were helping people to stay healthy, keep them out of ERs, avoid unnecessary office visits, which provided an first year return on investment to our clients. And so they supported us in this battle, and we've continued to grow nicely from there.
It almost sounds like COVID-19, where we are actively seeking not to test people and actively trying to suppress data instead of using it.
Well, because if you test, all you're going to do is just find more cases. And so why would you want to keep testing? But testing to us makes a lot of sense. And we think it's important for people to understand where they are in their health journey and to be guided in terms of getting the corrective actions that they need to take to stay healthy.
So data and is a key component to the services that you offer through Livongo. What are other things that you use besides your smart connected glucometers?
So Livongo recognizes that individuals with chronic conditions, especially as our population is aging, people have more than one. You may know, Ray, that 70% of individuals with diabetes also have hypertension. Many individuals with diabetes, especially type 2, have weight management challenges. And a significant portion of our population is addressing mental wellness or behavioral health issues. And so we try to focus on the whole person. We're focused in cardiometabolic areas today in terms of weight, hypertension, trying to prevent heart disease. People don't die of diabetes, they die of heart disease. And so what we're doing is we're trying to provide an opportunity for individuals to receive a number of different modalities that they can use to measure their health and use that information then to provide them with guidance that's important to them in the moment. So you may have had experience with what I'll say were version 1.0 disease management programs, where your health plan might see that you had a diagnosis of hypertension, and then 6 months later, someone will send you a letter or someone will call your home and say, gee, we see you have hypertension, we're here to help you. And people don't return those phone calls and don't respond to the letters. But if you're measuring your blood pressure and you're looking at that blood pressure cuff and you see a reading, and instead of it being 120/80, it's 150/113, you know that there's an issue, but you don't necessarily know what to do about it. You don't know how to interpret those numbers. We interact with you at that point in time to help guide you through that.
So you have health coaches that are part of your plan. You also capture data from PBMs, electronic health records, and even some vision providers. You also use other connected devices beyond glucometers, including blood pressure cuffs. Can you tell a little bit about how you integrate all these services to improve diabetes care?
Yeah, so our philosophy is all data is helpful. And we have a proprietary engine that we use in order to apply the health signals that we're seeing that come from you and about you into delivering guidance. And that engine is called our AI plus AI engine, which stands for aggregate data sources. I'll come back to that in a moment. Interpret that data and then apply it in terms of giving you guidance, what we call health nudges, to direct you on a course of change in behavior. And based on how you interact with that message, what you tell us, we then take that information and we iterate into an ongoing feedback loop that allows us to continually improve the messages that we're delivering. Today at Livongo, we have over 750 million data points that we've received. We also have the largest database of real-time finger prick blood glucose data in the world. And we use that information to provide the insights that we deliver to our members. We receive, if you enroll through a health plan or if you were to enroll through an employer, we'll receive information, again, permission-based, health risk assessment data, claims data, demographic information. Where do you live? How old are you? We receive information about what medications you're on. We might also receive lab results about you, as well as if you're wearing a Fitbit or an Apple Watch, you can share information, activity level data about you. And if you're using other types of devices in your home, we can capture that as well if they're connected. And so we pull all that information in to use that as part of that aggregate layer. We normalize it, and then we interpret that to provide you with the right type of guidance. Information that you might receive as a healthy male in your 40s in Rochester, New York, will be very different than what a woman of the same age might receive if she lives in New Orleans. And it really depends on your life circumstances to where it is we engage with you about your health.
You capture a lot of data, 750 million data points. How do you protect privacy?
Well, trust and confidence is the currency that we live by when you provide services to consumers. And so we've built out our security models similar to that which you'd expect from other organizations, SOC 2 and other levels of security provisions that our development team is doing. We meet a variety of standards that our key partners, which are health plans and pharmacy benefit managers, insist on. When we've gone through with some large Fortune 100, even Fortune 10 size companies, they put us through the security version of a colonoscopy, making sure that we're able to meet rigorous standards in terms of protecting data. And we do everything that we do on a permission basis. The data always belongs to our members.
Let's talk a little bit about your customers. Who pays for Livongo services?
So our customers are paid for organizations that are at risk for the cost of care. That's a health plan, that's a self-insured employer. It may be an at-risk provider group if they're participating in a program where they're taking risk, or a provider group is sponsoring a health plan. It's labor unions and government entities are also ones who are paying for our services.
So private employers like Target, you'll go to them, say, we'll improve diabetes care, we'll charge your employees X dollars per member per month for a suite of Livongo services and improve their care?
So the employees, what we call our members, pay nothing for our services. They're covered by the sponsor. So if they're paying in to their health plan that is sponsored by Target, in the example you used, this is all part of a benefit that they receive as part of that plan. One key differentiation between Livongo and the way other models have worked, especially for employer wellness, is that Livongo is only paid per participant per month. It's very different than a lot of other wellness programs where the vendor is being paid across an entire population. And frankly, their motivation is, we don't want people to use it, because the more people use it, that just drives cost to us as a supplier. In our model, we're very focused on getting people to use it because we align our interests with those of our clients who are paying our bills to make sure that it's the people who are using it that they're paying for. They're not paying kind of a subsidy across multiple people in a population and hoping some people don't use it to subsidize the cost of those who do.
So if Target only has 20% of its employees who have diabetes, they only pay for those 20% of employees.
That's right. That's right. And only those 20% that we enroll and that are participating in using our program.
Can you tell us if your program saves employers money?
Our program saves employers a lot of money. We have a number of studies, all publicly available at our website, many that have been published at sessions for American Diabetes Association and American Heart Association that demonstrate between 2 to 3 times what we're paid for our services is saved by those who are our clients. 100% of those clients who have measured their return on investment for the second and third years of using Livongo, 100% of them have positive return on investment. And we're pretty darn close to, I think it's 98% of those who we measure in the first year have positive return on investment of the scale that I'm describing.
So is Livongo now the world's largest provider of diabetes care?
So I don't know that we've quantified it on that basis, but certainly I'm now serving well over 400,000 individuals with diabetes on the Livongo platform. We're getting pretty darn close. But we do believe that we have, as I mentioned, the largest database of real-time finger prick blood glucose data. I will tell you that we certainly aspire, especially now with the partnership that we'll have with Teladoc going forward, that we will be the largest provider of services to individuals with chronic conditions globally, helping them live better and healthier lives.
So you made a transition there from diabetes to chronic conditions. Do you want to amplify?
So when you think about what Livongo is doing today, helping individuals with diabetes, hypertension, just in the US alone, those two conditions are a $47 billion market for Livongo, and that's US only. In the US, when you think about the population of individuals with diabetes, well over 30 million individuals with diabetes, that's been growing by close to 500,000 per year. So while we're concerned certainly in our current circumstances with a pandemic of COVID-19, we have an epidemic of chronic disease in this country with increased numbers of 40% of the US adult population has hypertension. So really large addressable markets that we think that we can pursue in the US and then globally. As we look at our pipeline of additional solutions that we think about offering, we've announced publicly that we will be bringing out a cholesterol management solution in that cardiometabolic suite. And we've been looking at other areas of chronic conditions that we believe will be important for us to expand into beyond diabetes, hypertension, pre-diabetes, weight management, and behavioral health.
So you alluded to the fact 140 million Americans have at least one chronic condition. These chronic conditions account for 80% of healthcare expenditures. I'm a neurologist. What, are you thinking about any neurological chronic conditions?
Well, we'll have to talk to you about that offline, Ray, and see if you can help us with regard to that. But, you know, we are certainly blessed to be living at this time and benefit from longer lifespans than our ancestors had, because we're doing such a good job in terms of allowing people to extend their lives. And in many cancers now, they are considered chronic conditions. People who used to pass away from cancers in the past today are living long and productive lives. And we've seen it with other conditions as well. And so, you know, our hope is that using technology, we can help people self-manage and allow them to live with guidance that counselors like Livongo can provide, and certainly with the medical professionals that we'll be able to link them to with Teladoc can be delivering to be able to manage these conditions on their own and live very long and productive lives.
I'm going to remind my listeners we're going to take questions from you as always with Lee. So put your questions into the Q&A function. We'll let Lee get a drink of water there. So you mentioned a lot about diabetes. 75% of individuals who've been hospitalized with COVID in the United States have diabetes, hypertension, or obesity. All of these are preventable. All are preventable. Almost all are preventable. What can be done to prevent them, and what's Livongo doing?
Well, without a doubt, you know, these are conditions that can be managed so that people can live in a way that doesn't cause the exacerbations that we've seen. And while individuals with the chronic conditions that you named are not more likely than the rest of the populace to contract COVID-19, if they do, they're clearly more at risk. And so by maintaining a healthy weight, by maintaining a healthy level of blood pressure and blood sugar, we believe that we can keep people out of hospitals and allow them to live healthy at home. The things that we do in terms of that guidance are things that you need information about at the time that you're thinking about your health. So you may know that one of the measures for blood sugar levels is called an HbA1c. It's an average. It's measured over a 90-day period typically. Ray, if you and I each had the same average, a provider might treat us the same way. But yet, if your blood sugar is in control for most of those 90 days, where if my blood sugar is revving up, high and low, high and low, high and low, I might have the same average as you, but clearly we shouldn't be treated with the same protocol. And what I'm doing is putting a lot more stress on my engine, so to speak, in a way that could cause me more health challenges. And so the advice that I'll receive will be different than the advice you receive. You're not just treated as a statistic, you're treated as an individual in the Livongo program, and getting advice about your medication, your diet, your exercise, that will allow you to hopefully be able to stay within range for you. And time and range is really important.
Related to diabetes and hypertension or disparities, huge issue for African Americans and Latinx populations. How's Livongo serving those populations?
Well, one of the things that we believe our solutions, broadly characterized as remote patient monitoring or digital health, can certainly help address some of the challenges we face with access to care. And we see access really in multiple areas, certainly in many of our urban centers, but also in rural populations. And just a couple of months ago, in June, there was a bill introduced, a bipartisan bill, in fact, one of the few bipartisan things happening in Washington these days, titled Increasing Rural Health Access During the COVID-19 Public Health Emergency Act. Just rolls right off the tongue. But that bill would make tens of millions of dollars available to facilitate remote health, remote monitoring in rural communities and medically underserved populations during this public health emergency. And so we qualify to be able to provide those solutions. And it's our belief that this model of consumer-centered virtual care is one that CMS acknowledges and that our Congress is recognizing as being able to address chronic conditions using our smart kind of cellular connected connectivity and the ability to implement in a timely manner to help address some of the disparities that we see in the environment that we operate in today.
Most of your services rely on certified diabetes educators, very little on physicians. Why is that?
Well, so we proceeded to get approval from the FDA, or clearance, if you will, from the FDA for our solutions. And we're very clear that we're not providing medical advice. What we're doing is we're empowering consumers to have a dialogue with their provider about their conditions. So if your blood pressure, in the example I used earlier in our talk, is running somewhat high, we provide you with a talk track, if you will, guidance that you can use to speak with your provider about your medications. Maybe the dosing isn't right. Maybe there's a different medication that would work better for you. What we see coming forward in terms of our combination with Teladoc is we will be able to seamlessly move individuals from that coached care, if you will, self-guided and coaching that we make available at Livongo, and allow a step up to work with providers in a virtual care model. And ultimately, if the Teladoc provider believes that an in-person visit is warranted, of course, they'll recommend that as well.
Do you envision that you're going to be the largest provider of healthcare in the country?
Well, certainly when I look at the tens of millions of visits that Teladoc reported just in the last quarter, it's very tough to rival the type of infrastructure in any given single organization versus what we have with regard to a national and increasingly with Teladoc, an international scope. So I do see Jason Gorovic and his team at Teladoc having an aspiration to be the largest provider of healthcare services in the world. And I think that these types of tools can certainly allow us to get there.
So publicly traded companies are going to be the largest providers of medical care in the world going forward?
I would certainly hope so.
And why do you say that?
Why do I hope so, or why do I say that they'll be the largest providers?
You said hope so. I said, why do you hope so?
You know, because I believe that, look, when you think about the way that Netflix has organized content, and Amazon has organized commerce, and Google has made it easy for us to search a wealth of information around the world, the tools and services that are available and the knowledge that's available and the accessibility of that information is more than what any one individual can do. You had mentioned early on that I attended law school, and I am a recovering lawyer by admission, to those of you watching. But when we did legal research, we were sitting in stacks of books in libraries and chasing case citation, and looking up case by case. Medical information moves even much more rapidly, medical knowledge develops much more rapidly than what we see happen with regard to legal information. And the accessibility of being able to bring all that knowledge to any one provider is really challenged. And so I think that use of digital tools, making information available, sharing best practices across large networks like this is going to help improve care and make it not only more accessible, but frankly, I think deliver better outcomes in the long term.
You talked a little bit about the advantages. What are your biggest concerns about the merger?
Well, certainly any merger of two companies requires there be a mesh of cultures. And I believe that both companies have demonstrated a facility of being able to do that. Livongo with 3 acquisitions that we've made since our inception, and Teladoc with some much larger acquisitions that they've made over time. And I think that they've been able to blend those into a unique framework of services that they're able to bring to market that no one else can rival. Our belief is that the merger of these 2 companies will come together in a way where we both have an interest in seeing the health of individuals improve around the world. We're united by a common mission, and I believe that mission will allow us to make this a very successful coming together. If we were large competitors across our businesses and had been battling each other in the marketplace for a long time, it might be harder to make that happen. But frankly, the fact that we have little to no overlap in the services we provide, only 25% of our clients are mutual clients. I think it will make it very easy for the companies to come together and bring our services to market easily.
Before we get to the questions from our listeners, I want to ask you a little bit in your role at 7Wire Health. In the midst of this COVID-19 pandemic, digital health is having its finest hour. Why is that?
Well, I think that when we started 7Wire Ventures some years ago, we did so with an idea that we can create connected and companies that support connected and informed health consumers. And there's 2 important words there. One is health, and the other is consumer. If we were to ask all the participants on the line today, some 50 folks or so, how many of you want to be patients today? I'm not sure we'd get a big raise of hands, but every one of them would answer this question positively. How many of you want to be healthy today? We all aspire to be healthy. And so as consumers, we want to have the power to be able to make decisions, to be informed about those decisions, and as well not have something done to us, but have us involved in the process of how it is that we're accessing and receiving care. And so digital health really provides that ability for us to be empowered. There's a number of different, I'd say, avenues within digital health, swim lanes within digital health. We've been very focused at 7Wire Ventures on finding ways that we solve all the hassles that we see as consumers in terms of accessing health. And frankly, my daughter said it best just recently. She needed a refill of a medication that would typically have required her living in LA to drive to her doctor's office. 45 minutes to get there. Apparently you can't get anywhere in LA without driving 45 minutes. A good 30-minute wait in the doctor's office, another 10 minutes in the exam room, see the doctor for a couple of minutes, get the refill of medication, and then drive back another 45 minutes. She was able to access Teladoc and do all of that within 2 minutes. And she said, like, why in the world would I ever go back to doing this the way I used to do it? It's so easy for me to access care this way. And I think that a lot of other consumers feel the same way. And that's why this is a moment for digital health. When you're really constrained from going to the doctor and you find new avenues to get access to care, I have an annual checkup tomorrow morning, actually. Doing it all online, 8:40 a.m. tomorrow, virtual visit. So, I'm excited about not having to drive into the doctor's office and wait myself.
So we got some questions. Dr. Eddie Schwartz asked, what is the underrepresented minority participation in Livongo? Can you use a target employee example if possible?
It's fascinating in terms of where we see participation in Livongo today. The average age of the population we serve is 51 years old. We cross all segments of the population, both in terms of race and gender. We see a significant number of retirees coming into our program because we have a number of unions. So for example, we provide services to the Postal Workers Union. There's a very strong representation of minority communities in the Postal Workers Union. We serve the Federal Employee Health Benefits Program and the Government Employees Health Program, GHA and FEP, with millions of members that again is very representative of the population as a whole. So I think that when we look at our population, it is very representative of that, but skewed in age and also skewed a little bit towards populations that have traditionally been employed. We are not serving Medicaid populations today, but we are serving a number of individuals in the Medicare program.
Do you see differences in uptake of your services among minorities versus non-minority groups?
We have seen great adoption across all populations and no differences in terms of how they're utilized. Interestingly, because the way in which we make our technology available, it does not require internet access. All of our devices that we're providing have ubiquitous cellular connectivity. And so in some respects, we get past some of the digital divide that exists in other types of services that require the availability of the internet. Our devices don't require that. And so that makes it more accessible to minorities who are potentially in areas that don't have access to the net.
Jerome Fisher says, with Livongo's use of blood glucose meters, were you able to shift your architecture to the use of continuous glucose monitoring, as United Healthcare has recently done?
Continuous glucose monitors are fantastic. They provide a number of readings. So as opposed to someone who might be doing a finger prick, if it's an individual with type 1 diabetes who's doing it multiple times a day, continuous glucose monitor is taking multiple readings every hour. And we love the fidelity of the data, and we use that and ingest it into that AI engine that we spoke to before. We have a portion of our population that are using continuous glucose monitors today, and we're very supportive through our partnerships with Dexcom and with Abbott Libre around the use of those monitors. They're not for everyone. If you've worn one, you have to have a patch that you change the location of every 2 weeks. Those patches can be expensive. You run out of those patches, and you have to go through some hurdles to get them. And the devices are still relatively expensive. So when we think about the wide-ranging availability of care, especially on a global basis, we still see use of glucometers as being here for a long time.
Catherine Eisenberg asks, can you talk about Livongo's approach to EHR integration with all the data and analysis you mentioned earlier?
So my apologies in advance to those of you physicians on the line who use electronic health records. We certainly didn't design them to be the burden that they've become in your day-to-day existence. But Zane Burke, our CEO, hails from Cerner, Glenn and I from Allscripts. We have integrated across, I'd say, virtually every electronic health record in terms of being able to pull in data as well as being able to share data back into electronic health records to the extent that our members are looking at sharing information with providers. Today, we have over 100 health systems as clients, most of whom are using Livongo to manage the health of their own employee populations. Because, Ray, as you may know, University of Rochester is an at-risk employer. They're providing care to the team that works at your medical facilities. And so they want to manage the health of those individuals using tools like Livongo. And so what we're finding is that in those cases, having the ability to integrate and share information with a primary care physician or a specialist, depending on member choice, is open and available to us. But we know a little bit about EHRs.
We could have a long discussion. Debbie Baker says, my daughter has had type 1 diabetes for 20 years. How is service and data for type 1 diabetes different than, say, type 2?
So around 15% of the population that we work with at Livongo has type 1 diabetes. Certainly individuals with type 1 have a more intense and frankly, an experience that requires them to be monitoring their blood sugar far more often than individuals with type 2. And what we have is an offering where, as Ray mentioned, our coaches are available 24/7. And as part of the coaching services that we provide, especially for parents like yourself with a child who has diabetes, our diabetes response specialists are on call 24/7. If we see someone, whether it's because they did a finger prick or they're wearing a continuous glucose monitor, is trending too high or too low, hyper or hypoglycemic, then we'll reach out to that individual. We also reach out to the care team that our member has established. So what we're able to do is set up a circle of family and friends. It could also include providers that are notified. So if my blood sugar is too low and Ray is in my circle, or Ray is my roommate at college, Ray might get notified to say, you know what, you better go check on Lee. We've advised him not to move because his blood sugar is too low. We don't want him to pass out. And so why don't you bring him a glass of orange juice and let's monitor him together. And so we provide that type of guidance through the services that we deliver today, 24/7.
Our friend Dr. Adam Dicker at Thomas Jefferson University in Philadelphia asks, what's the role of small startups in the digital health space? Is there still room to innovate?
Well, so one, I'd say ask Steve Klasko in his new book, Unhealthcare, that he wrote with Hemant Taneja. Steve is the CEO of Thomas Jefferson, and Thomas Jefferson is a great partner and client of Livongo. Answering your question after that plug for TJU, we see that innovation really occurs with these early stage companies that we've been able to back at Seven Wire Ventures. The entrepreneurs that we work with, many times they're individuals who have been in healthcare organizations for a long time, have some new models that they want to bring forward and opportunities that they see to improve care. And we work with them even at a stage before they have revenue to work on a business model with them to try and integrate that into the ecosystem and provide some of these new innovations. I think that venture capital provides a resource to continue to fuel innovation. That's a really important part of the way that we can continue to see advances made, not only in terms of digital health, but frankly in other businesses that help improve our lives.
Yuri Shaw asks, how do you engage with senior citizens that are less tech savvy, and how do you get them to use your platform?
So as I mentioned, the age of our population is in their 50s, but we also have a number of retirees that are using it. The great thing about the Livongo platform is that it fits into, as I said, your life flow. So if you're an individual with diabetes or hypertension and you were using a blood pressure cuff previously, or you were using a glucometer, you still use a modality that you're used to. We've made it smarter, and we surround it with services. So it's the data we receive, the information that we send back to you, and if that nudge is something that you literally see on the device when you're testing your blood sugar, or it may come to you on your phone if you're using a cell phone. It can come to you through email. It can come to you in a phone call. So you choose the way in which you receive the types of messages that we deliver, and that multimodal approach allows us to serve broad segments of the population, including those who may not be tech savvy. What we find is that most individuals are interacting with us through the devices as well as on their cell phone, and seniors are pretty savvy in terms of using smartphone technologies today.
Before we close, I want to highlight that our next Chet Talk is Wednesday, August 26th, next Wednesday, 12 noon Eastern. And we'll be speaking with the former Commissioner of the Food and Drug Administration, Dr. Robert Califf. Dr. Califf is now Alphabet's new head of medical strategy and policy. If you want to know what Verily plan is for COVID-19 testing, you'll join us next time. If you want to know when a vaccine might be available, you can ask him. And if you want to know what the future of digital health is, you're going to listen to Lee's final answers, and we'll also see you next week.
And by the way, Rob is terrific. He's a wonderful guy. I'm certainly glad that my Chet Talk was before his, not after his.
So the COVID-19 pandemic has laid bare many shortcomings in healthcare, including the link between health insurance and employment. 13 million Americans have lost their jobs. The number of Medicaid beneficiaries may reach 90 million, and the number of uninsured is likely to decline. What does this mean for Livongo?
Well, from a Livongo perspective, we think that availability and access to care is really important, and being able to provide that is critical to serve populations that are in those conditions. We've seen a significant amount of interest from a number of sources, including from the government perspective in terms of making our solutions available. Recognize that what we do is deliver a great consumer experience at a lower cost with improved outcomes. And so as we've had dialogue with HHS and the team there, they appreciate that the types of services that we use are ones that could be available across a broader range of programs. And so my hope is that our economy turns around and we put people back to work. But until they do, having availability of these solutions that allow them to access care in a way that doesn't require them to put themselves at other health risks is really important. And I believe that we can play a meaningful role there.
So last night at the Democratic National Convention, Senator Bernie Sanders discussed expanding Medicare to at least those over 60. Do policy changes like Medicare for all threaten Livongo?
No, as I mentioned, we serve a large population of retirees today. This is about how do we make care more accessible, more informated in terms of better knowledge and information that allows individuals to manage care to the level that it needs to be managed, and to do so as much as they can on their own and with guidance where appropriate. So we see that irrespective of whether it's Medicare for all, it's Obamacare, it's Trump care, the trend is frankly one towards more and more utilization by consumers of tools that they use elsewhere in their lives, and using technologies like Livongo and telehealth from Teladoc are here to stay. As Alex Azar has said, the genie is out of the bottle with regard to telemedicine and I'd say digital health. And we think that we have an important role to play for the long term.
So you've given us already one bold prediction that the merger between Teladoc and Livongo will become the largest healthcare company in the world. Do you have any other bold predictions for the next 6 to 12 months?
Chicago Cubs will win the season-shortened World Series, and that I also think that I will be back on Chet Talks within the next 12 months. That's my second bold prediction.
I love it. We'll be delighted to have you, Lee. We'll have you with your Cubs hat on, and you can talk about University of Chicago, where fun goes to die, and where my son will be a freshman next month, all COVID permitting.
Well, make sure he gives us a call in the Chicago area if he needs anything, and certainly if we can ever be helpful. So, Ray, best wishes to you, and thanks everyone who joined today.
Lee, thank you very much for joining us on Chet Talk. Congratulations on all the great work at Livongo and the merger. Until our next discussion with Dr. Robert Califf next week, the Center for Health and Technology at the University of Rochester. Thanks you for joining us. Thanks again, Lee.